Welcome to the Dallas County Medical Society's 2021 Virtual Presidential Installation and Award Ceremony, with Kevin Klein, MD, as Master of Ceremonies.
Good evening, ladies and gentlemen, and welcome to the Dallas County Medical Society's Installation and Award Ceremony. I'm Kevin Klein, the immediate past president and chairman of the DCMS Board of Directors. I have the honor to serve as your Master of Ceremonies this evening. To say this year 2020 was remarkable is an understatement. The very nature of this installation and award ceremony being held virtually is a symbol of the far-reaching impact COVID-19 has had on all our lives. As physicians or family members watching, I know that each of you has been touched in some way by the events that began unfolding in March. Doctors, we thank you for the sacrifices you've made serving your patients and the Dallas community. And family and friends with us this evening, thank you for selflessly supporting your physician as they answered the call. To begin our evening, our incoming president, Dr. Beth Kassanoff-Piper, has invited a special guest to provide our invocation. At this time, I invite Reverend Daniel Gowan to open our ceremony.
As we come together tonight, let us all be grateful for Dr. Mark Casanova and the work that he has done this past period of time as his presidency. This has been one of the most trying times ever for the medical profession, and Dr. Beth Kassanoff-Piper steps in to lead the DCMS in this trying time. Let us pray. We pray that Dr. Beth Kassanoff-Piper be given compassion, courage, and strength to lead the Dallas County Medical Society. Please grant these same strengths to all members of the DCMS as the medical profession continues to be a beacon of hope and strength for all in our community. Amen.
Thank you, Reverend Gowan. We're honored to have you with us this evening. Our first order of business tonight is to honor Dr. Mark Casanova for his service as our 2020 DCMS president. There's a bit of an inside joke among the leadership that each year the new DCMS president will face some unforeseen disaster or signature challenge, and for 2020 it was a doozy. Not only did Dr. Casanova have the obvious challenge of navigating us through COVID-19, but he was also working with our brand new Executive Vice President and CEO, John Roth, who came on board just 8 weeks before the pandemic hit. We cannot thank Mark enough for his invaluable service and leadership to DCMS and the greater Dallas community last year. Not only did Dr. Casanova lead DCMS through these unprecedented times, but he also contributed in so many other ways. He served on the Dallas County Health and Human Services COVID-19 Task Force, the TMA COVID-19 Task Force, and co-chaired the rewriting of the North Texas Mass Critical Care Guidelines. This leadership provided a great opportunity for Mark to become the trusted voice of information for Dallas area residents as he conducted over 150 television interviews as president of DCMS since the pandemic began. Mark, thank you for your dedication and service. This evening, Dr. Casanova is being presented with the DCMS Past President's Ribbon and Medallion, a Past President's lapel pin, which I forgot last year, and an engraved Mont Blanc pen as a small token of our thanks for his tremendous leadership and perseverance in 2020.
Thank you, Kevin, and thank you for the opportunity to provide a few outgoing remarks for Dallas County Medical Society. I'm going to try to keep this short and succinct. I do believe that all of us wish we had the magic wand that could have kept 2020 short and succinct. A year ago, the board and I committed to you to doing absolutely nothing that was different than what we've come to expect from Dallas County Medical Society. A leader of health, promotion of welfare for our community, and I'm proud that we've lived up to that commitment of doing absolutely nothing in 2020. We remained at the helm of the ship to ensure that our public was kept safe. We relied on members with expertise in public health, infectious disease. We helped each other $14 million worth of PPE distributed with the assistance of TMA to physician members in our community that not only helped keep their practices open and viable, but assisted them in providing care to patients in need. We have a lot to be proud of at DCMS. This has been a trying year, to say the least, but there's hope on the horizon. And I'm so proud that we're celebrating Dr. Beth Kassanoff-Piper tonight, a friend and a colleague of mine in training when I was a young physician, and certainly have learned a great deal from her. She was indispensable in our leadership this year, as was the staff of DCMS, and we can't thank you enough. It's dangerous to begin to name names because invariably I'll forget folks. But in closing, I definitely need to thank a few key members, and those are my family. Those that have been patient for me. My daughter, who understands that when Dad gets home, it's Zoom time on the computer every evening. My father, for his patience with me and his ability to stay at home and let me run and go to the grocery store. And most of all, my wife, who I couldn't have done this without this last year. I love you so much, and I appreciate you. So, Beth, the helm is yours, and we look forward to an exciting year.
Thank you again, Mark, for everything you've done and continue to do for Dallas County Medical Society and our community. We had the right leader in the right position at the right time with you as our president. Events such as the induction ceremony are not possible without the generous support from our sponsors who provide critical resources for the Society. I'd like to recognize and thank our generous sponsors for making tonight's event possible: the Texas Medical Association Insurance Trust and the Texas Medical Liability Trust. Thank you so much for your ongoing support. Even though not in person, we're honored to have special guests join us tonight. They are our friends and colleagues from the Texas Medical Association. We'd like to thank the following leaders for their support: TMA President Dr. Diana Feit, TMA Board of Trustees members Dr. Sue Bornstein and Rick Snyder, the TMA Foundation President Dr. Deborah Fuller, TMA Alliance President Ms. Jennifer Lewis, TMA EVP CEO Mr. Michael Derazette. Michael, welcome back. The DCMS Alliance President, Ms. Kaki Hopkins. Dallas County Judge, Mr. Clay Jenkins. And the Health and Human Services Director, Dr. Philip Wong. Thank you all for joining us this evening. We also want to recognize our Dallas County Medical Society leaders who volunteer a great deal of time to DCMS and have been assisting along with Dr. Casanova during a very difficult year. The 2020 DCMS Board of Directors, in addition to myself, are Dr. Beth Kassanoff-Piper, President-elect, Dr. Sam Chantillis, Secretary-Treasurer, Dr. Christine Becker, Dr. Donna Casey, Dr. Shana Drummond, Dr. Deborah Fuller, Dr. Robert Gross, Dr. Gil Kirkpatrick, Dr. Viral Patel, Dr. Archana Rao, and Dr. Lisa Swanson. In addition, we want to recognize the incoming board members for 2021, Dr. Shana Drummond, Dr. Emma Dishner, Dr. Angela Momeka, and Dr. Joe Sad, along with Dr. Bradley Weprin. I want to thank you all for the service that you've given to DCMS and for those who are going to carry us forward. I know we will be in good hands with your leadership. It's now time to install the 138th President of the Dallas County Medical Society, Dr. Elizabeth Beth Kassanoff-Piper. Dr. Kassanoff-Piper, will you please join me? Before we conduct the installation, let's first learn a little bit more about Dr. Kassanoff-Piper.
From a young age, Dr. Beth Kassanoff-Piper has always had a passion for helping others. Along with a strong love of science, Kassanoff-Piper set off on a path that would utilize both qualities. Medicine. Becoming a doctor was not always the clear choice for Kassanoff-Piper, but shortly before leaving for college, her grandfather inspired her to find a career in medicine. He said, "I want you to be one of those doctors that does somebody good," she recalled. Kassanoff-Piper attended Louisiana State University, but it wasn't until a class trip to a medical school in her first year of college that Kassanoff-Piper realized medicine was her calling. After graduating from LSU, Kassanoff-Piper chose UT Southwestern Medical Center in Dallas for her medical training. At UT Southwestern, Kassanoff-Piper felt a great sense of community and encouragement as she moved through medical school. In the years following, Kassanoff-Piper attended residency training at Barnes Hospital in St. Louis, Missouri before returning to Dallas. Kassanoff-Piper has been practicing internal medicine for 21 years and loves this specialty for her ability to care for entire families. Kassanoff-Piper joined the Dallas County Medical Society in 1992 while in medical school and has been a member ever since. In organized medicine, Kassanoff-Piper has greatly enjoyed advocacy, volunteer opportunities, and chances to work with physicians from different places and specialties. While planning her year as the president of DCMS, Kassanoff-Piper realized that continuing to navigate COVID-19 and support DCMS members would be her primary objective. She is focused on maintaining partnerships with the Texas Medical Association and Dallas County's public health experts and community leaders to provide evidence-based recommendations for the community. Kassanoff-Piper also wants to focus on improving the public's acceptance of vaccines. Outside of medicine, Kassanoff-Piper finds great support in her family. She speaks warmly of her parents, her husband, and their blended family of 6 children. When she's not practicing medicine, she loves spending time with her family and reading mystery novels. She looks forward to the day she can travel again. Please welcome the 138th president of the Dallas County Medical Society, Dr. Elizabeth Kassanoff-Piper.
Traditionally, we invite all the DCMS past presidents and current board members of the DCMS Board of Directors to come forward and embrace this important event with the witnessing of the oath of office. Unfortunately, we're unable to accomplish this virtually, but we have photos of the past presidents and board members surrounding the screen to embrace this important moment. Dr. Kassanoff-Piper, you have been elected by the membership of the Dallas County Medical Society to serve in the highest elected position in the organization. It will be your duty to represent the membership and to advance our mission and the goals of DCMS. Dr. Kassanoff-Piper, please raise your right hand as I administer the oath of office. Do you solemnly swear that you will carry out the duties of the office of President of the Dallas County Medical Society?
I do.
That you shall strive to maintain the ethics of the medical profession and to promote the public health and welfare of the citizens of Dallas County?
I do.
That you dedicate yourself to improving health standards and to expand access to medical care for every citizen?
I do.
That you uphold the bylaws of the Dallas County Medical Society and the Texas Medical Association at all times?
I do.
That you shall champion the cause of freedom in medical practice and for your fellow citizens?
I do.
To these obligations, do you pledge yourself, so help you God?
I do. To these duties and obligations, I pledge myself, so help me God.
Beth, it's time to pass the baton and the leadership pen of Dallas County Medical Society with COVID-specific cleaning protocols. I want to congratulate you, my friend, my colleague, and the 2021 president of Dallas County Medical Society. The ship is yours.
Thank you, Mark. Good evening, and thank you for joining us tonight. I'm honored to be installed as the 138th President of the Dallas County Medical Society. Since the formation of the DCMS in 1876, our physician leadership has guided the residents of Dallas County through a number of crises. In my career, we've seen the West Nile and Ebola crises, as well as several devastating hurricanes. The current COVID-19 pandemic is the largest crisis in a century. The scope of its impact in terms of loss of life, loss of employment, loss of health insurance, and loss of physician practices is not yet fully known. Our leadership through 2020, Dr. Mark Casanova and our CEO, John Roth, have worked tirelessly to guide us through this crisis. As we move into the second year of the pandemic, DCMS will continue to serve as the trusted voice of medicine, the source of up-to-date, evidence-based information for our members and the community. I will continue to work with the North Texas Medical Society Coalition, which provides that information to North Texas as a whole. And DCMS will continue to partner with the TMA, county public health experts, and community leaders such as our special honoree, Judge Clay Jenkins. And we'll continue to help our physicians with issues related to the practice of medicine in a pandemic, including financial concerns, telemedicine, payment issues, and physician mental health. We are now armed with the experience of multiple months of COVID care and research, good information about prevention strategies, and we have new promising treatment options. And COVID-19 vaccines are coming. One important goal I have for DCMS is to improve the public's acceptance of vaccines, both COVID and non-COVID. The AMA also recognized combating vaccine misinformation as an important goal at their recent House of Delegates special meeting. We need to also recognize other issues DCMS will face in 2021. This is a legislative year in Texas, and our members will, with the TMA, participate in virtual meetings with legislators, replacing First Tuesdays for this year. The lack of face-to-face interactions means that learning about and communicating with legislators individually is more important than ever. Important issues this year will include telemedicine payment parity, prior authorization, and care for the uninsured and vulnerable. I urge members to get involved with this worthwhile effort. We have an opportunity right now to make a difference. DCMS will also be enacting our 2-year strategic bridge plan with several important priorities. These include charging the new Diversity and Inclusion Committee to educate physicians on the importance and richness of diversity and to highlight opportunities for us to be more inclusive of all our members. We will work to expand our communication sophistication to provide relevant information to our members through different platforms, meeting physicians where they like to get information, and providing education for physicians in all healthcare payment models. We also want to increase member engagement and expand our community outreach by working with other local groups, such as the DCMS Alliance. I want to thank Dr. Casanova and the other past presidents for their outstanding leadership, and to thank our CEO, John Roth, and all the DCMS staff for their commitment to our medical community. I would like to thank Reverend Daniel Gowan for delivering our invocation tonight. And I would like to send a special thank you to my husband, Mick Piper, and my parents, Jerry and Pat Andrews, for their constant encouragement and support, and to my children for their understanding and patience during this hectic time. 4 of our 6 children, including the triplets, are high school seniors this year, and I can't wait to see what wonderful contributions they make to our world. Thank you for the opportunity to serve you. 2021 will be a year like no other, and DCMS will be working right alongside you, just as we have for the last 145 years. Please contact me or any of our board members or staff if you see an opportunity for DCMS to make a difference. Thank you.
Thank you, Dr. Kassanoff-Piper, and congratulations again. We look forward to supporting you in your journey. We'll now begin the awards presentation of our ceremony. After a combined 50 years of service from Millard J. and Robert L. Heath, the father and son, who were the first executive officers of DCMS, the Medical Society established an award to honor and recognize a layperson who has provided outstanding leadership to medicine and to the Dallas community. The 2021 Millard J. and Robert L. Heath Award recipient has been a valued and well-respected community leader and contributor to medicine for many years. Let's take a look at his accomplishments.
After graduating from Virginia Polytechnic Institute and State University in 1973, Stephen Love began his healthcare career in 1975 at a 450-bed tax-exempt facility located in Virginia. He served in various capacities of healthcare management at the hospital, division, and corporate levels. Stephen is currently the president and CEO of Dallas-Fort Worth Hospital Council, which promotes collaboration and advocacy on behalf of its 90-member hospitals. He has served as 2015 chair for the Conference of Metropolitan and Regional Hospitals Association in the United States. Prior to joining the Dallas-Fort Worth Hospital Council, Mr. Love was Senior Vice President and Chief Financial Officer of a Fortune 500 healthcare company that owned over 50 hospitals and managed approximately 200 facilities in the United States. Stephen Love has extensive experience in healthcare finance and has utilized his knowledge to assist and advocate for hospitals at the state and national level, working with the Texas Hospital Association and the American Hospital Association on numerous efforts. He has made inroads with numerous politicians when working on the approval of non-smoking ordinances across North Texas, regularly attending city council meetings in Fort Worth, Addison, and Arlington to provide reports on the dangers of secondhand smoke. He has made himself readily available to numerous organizations, including the American Heart Association, United Way, Children at Risk, and Mothers Against Drunk Driving, serving on multiple committees. Stephen Love's experience with the media throughout the years, to include his weekly radio program, The Human Side of Healthcare, which he hosts every Sunday on KRLD 1080 AM, made him the perfect choice to serve as spokesperson for North Texas hospitals during the COVID-19 pandemic. Over an 8-month period, he has spoken with both local and national media over 250 times. His knowledge of the pandemic, combined with his relationship with regional hospital CEOs, allowed him to create and distribute a consistent message to the public. Stephen Love has tirelessly communicated to the public on the dangers of the COVID-19 pandemic. His goals were to decrease the growing panic as to the availability of hospital rooms and equipment, while also conveying the importance of wearing a mask, social distancing, and washing one's hands. His message was consistent throughout 2020. He wanted the public to understand that while hospital beds were available, it was important for the community to avoid exposure at all costs. His advocacy work with Texas Governor Greg Abbott for federal aid and the removal of restrictions for nursing students in order to boost the healthcare workforce were both successful. His work with Dallas County Judge Clay Jenkins and Tarrant County Judge Glenn Whitley inspired the issuance of shelter-in-place orders. Stephen also altered the format of his radio program, The Human Side of Healthcare, to provide weekly updates on the COVID-19 pandemic, to include advice on opening the economy and proper habits while in public. In recognition of his outstanding leadership and service to Dallas County Medical Society and to the community of Dallas, the DCMS Board of Directors is pleased to honor the 2021 Millard J. and Robert L. Heath Award to Stephen Love.
I want to thank the Dallas County Medical Society for this award. I am so humbled. I have had the privilege and pleasure of working with many of you for over 15 years. We've worked on projects such as developing mass critical care guidelines, prevention and wellness programs for the community, and yes, helping people that are indigent and uninsured. I also want to thank the physicians that are part of the Dallas County Medical Society for your leadership during this pandemic. As you know, this ugly COVID-19 virus came to town in March. You had no real treatment protocols. You had never treated this type of coronavirus previously. And yet you stepped up, you helped your patients, you learned, you talked to physicians from throughout not only this nation, but the world. And you continued to treat and help the patients of North Texas. And I want to thank you also for all the work that you do, not only for Dallas County, but the entire North Texas area, the state, and the nation. You know, over the years, and I've been in healthcare 46 years, I'm an old guy, I've had a lot of friends and I've had a lot of colleagues, I've had a lot of mentors, people that have given me guidance and direction. And let me just say, in the last 15 years, I've received a lot of that guidance and direction from the physicians that are part of the Dallas County Medical Society. So I want to thank you for your friendship. I want to thank you for the work you do for this community. And I am so humbled and so appreciative of you taking time to recognize me. Thank you very much.
Congratulations, Steve. DCMS began honoring its most distinguished physician members in 1947 with the Marchman Award, named in honor of Dr. Oscar Milton Marchman Sr., who served as DCMS president in 1917. In 1985, our medical community discovered a new inspiration for excellence and recognized Dr. Charles Max Cole for his service to medicine and to the community. Since then, the Medical Society's Distinguished Physician Leadership Award has been named the Charles Max Cole, MD Leadership Award. The recipient of the 2021 Leadership Award is a physician who has spent his entire career as an advocate of public health, a champion and a friend to many of us. Let's take a look at his accomplishments.
Dr. John T. Carlo is an advocate for the underserved, has an endless passion for public health, and contributes countless hours as a physician volunteer with organized medicine to make our community healthy. Dr. Carlo earned his bachelor's and master's degree at Tulane University in biomedical engineering. In 1996, he moved to Dallas and began medical school at UT Southwestern Medical School. After graduating medical school, he completed a residency in general surgery at Baylor University Medical Center, also in Dallas. Carlo began his career overseeing public health services at the Dallas County Health Department before being hired as chief epidemiologist. Dr. Carlo went on to serve as the county medical director and was appointed health authority from 2006 through 2010. As a public health advocate, Dr. Carlo helped strengthen the community's response to numerous threats, including the H1N1 pandemic, West Nile virus, and large-scale hurricane shelter responses. 6 years later, Carlo joined the Center for Infectious Disease Research and Policy at the University of Minnesota, working with local and state public health officials to develop a biological threat and response capability. Dr. Carlo is recognized as a national expert on public health serving in the U.S. Department of Homeland Security and Federal Emergency Management Agency's National Training Program, where he advises elected officials on emerging infectious diseases and public health responses to disasters. Dr. Carlo is also an active member of the AIDS United Public Policy Committee and the American Heart Association Texas Advocacy Committee. His contributions do not end with his public health accomplishments. Dr. Carlo also has a rich history of volunteer service in the medical profession. This service was recognized by his peers as he was elected the 2017 president of Dallas County Medical Society. For his efforts in responding to the 2014 Ebola crisis in Dallas, he was awarded the Texas Medical Association's Presidential Award. Dr. Carlo currently serves on the TMA Council on Legislation and previously served as chair for both the Council on Science and Public Health and Council on Socioeconomics. In 2017, he was elected to the AMA Council on Science and Public Health. In recognition of his outstanding leadership and service to Dallas County Medical Society and to the Dallas community, the DCMS Board of Directors is pleased to award the 2021 Max Co-Leadership Award to Dr. John T. Carlo.
Hello, everyone. I am truly honored to be here tonight in receiving the Dr. Max Cole Award this year. I'm especially honored to be receiving it when we're inducting a great new president, Dr. Beth Kassanoff-Piper. And I'm also truly honored to be receiving this award this year alongside two other great champions in this community, Steve Love and Judge Clay Jenkins. And I think I'd be remiss to not mention the third partner of these two who have been alongside and really leading us as a medical society, Dr. Mark Casanova. It was an amazing presidency. Thank you for all of your work, your incredible hours, your commitment, and your incredible leadership. All three together standing in this evening tonight. We're not done yet, of course, with fighting the pandemic, but because we have such great leaders in this community, I feel confident that we're going to get through it together. I also want to thank John Roth, our new Executive Vice President. John came in, I think had about a month before this crisis all began. And John, it's hard to imagine that we only got one lunch together in person. I certainly wish we will get to do more together soon, but thank you for all of your service, as well as the rest of the great staff at DCMS. There are many, many great colleagues. I also want to thank Dr. Rick Schneider and Dr. Sue Bornstein, who are on the Texas Medical Association's Board of Trustees. Thank you both for all of your support. And I also want to thank and recognize the late Dr. Don Reed and his wife Roberta, who set an amazing pathway of leadership, of commitment to community, and also setting the stage for how to behave. And Don always told us all, whatever you do, be kind. I also want to thank Michael Derizette and Connie Webster for all of your support over these past years, now in your roles at TMA, but also, of course, in your many years of service as DCMS. Michael especially, thank you for your mentorship, your support, your friendship, all of the work that you've continued to do on behalf of health and physicians in this community and across the state. Let me recognize my family. First, my parents, my dad, Jim Carlo, who is no longer with us, my mom, Martha Carlo, for your love and support, my brother Daniel and his wife Christy, along with my two nieces, Eve and Lila. And finally, I want to thank my husband, Art Bloodworth, for all of your support, whether it was making sure that my Zoom background looked good, that I wore a clean collared shirt every day despite sitting in my office all afternoon and morning, or putting up with the sudden conference calls and disrupted evening schedules. Thank you for all of your support. I would not be here without you. Finally, please let me recognize the incredible team of people working at Prism Health North Texas, where I serve as CEO. I have the privilege to work alongside this great group of people in this community who truly get it. They're a compassionate group of people that truly understand how important it is to really make a difference in people's lives. This is often the hardest group of people to reach, often the most complex patient cases, people living with HIV in this community. It's incredibly complex, relies more on the social and societal determinants of health rather than the treatment itself. But it also takes an incredible group of people who are passionate, dedicated, and truly are ready to make a difference in people's lives. Again, it's an honor to be here this evening alongside such great awards recipients. And I also want to thank all of you who are on tonight. You know, we don't have the chance to sit and eat dinner together at the wonderful Park Cities Club, so I would imagine there'll be fewer of us listening in today and participating. And I think we all miss the fellowship of not seeing one another in person. But if you're listening tonight, it means that you are a true champion in this community, or you're supporting one of our champions in this community. And so for all of you tonight who are here, thank you for the work that you're doing. Again, I'm privileged to serve alongside of you and will continue to do so. Thank you.
Congratulations, John. You are one of the most deserving I could imagine for this prestigious award. As mentioned at the beginning of this evening's ceremony, the year 2020 will be noted as the most remarkable and impactful year that many of us will experience in a lifetime. There are so many individuals who have been heroes throughout the pandemic that they're too numerous to mention in this short time. However, there's one individual that DCMS and our physician leaders have worked with hand in hand to navigate the difficult path of keeping all Dallas County residents safe and healthy. In doing so, he always listened to his physician advisors, many of whom are current and past DCMS leaders. In almost every press conference, he was known for stating that his policy decisions pertaining to COVID-19 were what the doctors advise and what the best science calls for in this circumstance. This isn't the first time that this public official joined hands with medicine to make the best decisions for Dallas County residents. It was simply the latest experience. Whether it was West Nile virus, Ebola, Hurricane Harvey, or one of the other public health threats we've faced, Dallas County Judge Clay Jenkins has let science guide his decisions. Let's learn a little more about Judge Jenkins.
Dallas County Judge Clay Lewis Jenkins was born in the Oak Cliff neighborhood of Dallas. After graduating from Waxahachie High School, Jenkins enrolled at Baylor University, and after receiving his undergraduate degree, attended Baylor Law School and graduated with a Juris Doctorate degree. In March 2010, Jenkins entered into local politics by defeating the incumbent in the Democratic Party primary election for Dallas County Judge. In the November general election of the same year, Jenkins defeated the Republican candidate to earn his first elected position. After winning the election, Mr. Jenkins began serving as the Dallas County Commissioner Court Judge in 2011. Judge Jenkins is known for his courageous civic leadership and reliance on science and the advice of physicians when public health threats faced the county's residents. When Dallas County was hit by the West Nile virus in 2012, Jenkins initiated the important steps to begin aerial spraying for infected mosquitoes to reduce the outbreak throughout the county. Then, in 2014, when Dallas County became the first county in the United States to have an Ebola virus case confirmed, Jenkins led the local response. During the Ebola crisis, Jenkins won national praise from health officials for destigmatizing the disease, working closely with the impacted family, making sure they were safely moved from their home and able to finish their quarantine in a safe location. In 2020, when the SARS-CoV-2 or COVID-19 pandemic reached Dallas County, Judge Jenkins called together a group of public health experts, researchers, physicians, and hospital leaders to help advise him on policy decisions to contain community spread of the virus. Judge Jenkins has been recognized for following evidence-based medicine principles and physician counsel when making important policy decisions. The DCMS Champion of Science in Medicine was established as a new award in 2021. This award recognizes a leader in government or academics who contributes to public policy decisions that improve the health of Dallas County residents using the principles of science and evidence-based medicine. This award recognizes that individual for leadership in developing or advising public policies that protect or enrich the health of residents in the county. Judge Jenkins' leadership has undoubtedly saved lives and prevented suffering for countless residents of Dallas County. In recognition of Judge Jenkins' contributions to public policy that have improved the health of Dallas County residents using the principles of science and evidence-based medicine, the DCMS Board of Directors is pleased to recognize Judge Clay L. Jenkins as the inaugural recipient of the DCMS Champion of Science and Medicine Award. Please welcome Dallas County Judge, Mr. Clay L. Jenkins.
Thank you, Dallas County Medical Society, for the tremendous work that you have done this year. Dr. Klein, thank you for chairing the board, and Mark Casanova, thank you for joining us at the helm of all the key decisions that were made this year, for attending countless commissioner court meetings, for serving on the Public Health Steering Committee, and for all the great things that you did this year. And Dr. Kassanoff-Piper, thank you for your commitment to DCMS and to our community, and welcome and congratulations on your ascension to president of this great body. I want to thank you all for this award. I'm very humbled by it. I consider you to be friends and co-leaders in the effort to beat COVID-19. You know, I made my peace early on that a public health crisis is not one that lends itself to politics, but rather that the thing to do in a public health crisis is to rely on the advice of the people who have trained their entire adult lives to advise us in these moments. That is our doctors, our infectious disease specialists, our public health directors, our epidemiologists, the people who run our healthcare organizations. And my job is to swiftly and effectively implement the advice that you give so we can save as many lives as possible, protect our healthcare heroes from being overrun in our hospitals, and keep our community and our nation stronger until a vaccine could be found. Well, the vaccine is here. People are being vaccinated more and more, but you and I know the fight is not over. And so we'll need to continue to work hand in glove on this crisis until it is over sometime, hopefully later this year. I know there will be other challenges that will face us, and I will always listen to your advice on public health crises so that we can work together following the science and the facts and not being pushed away from following that guiding star of science and facts in protecting the public in a public health crisis. So again, thank you for your kindness in awarding me this award, and thank you again for all the work you have done and you will do keeping this community safe in 2021.
Congratulations to all of our award recipients and to Dr. Kassanoff-Piper for her installation as our new president. On behalf of the DCMS Board of Directors, we want to thank you for joining us at this first ever virtual installation and awards ceremony, and I wish you all a safe 2021. Good night and God bless.